It looks like we're up. Is that a yes, Fred?
Not yet.
Not yet. Okay.
It says now broadcasting.
You're live.
You all can begin your meeting.
Great, thank you. Well, welcome to the Joint Board of Health and Hospitals meeting this morning. Excuse me 1 second. I have to turn off the heater there. Dr. McBride, Professor McBride and I were just speaking. We're becoming really close, all of us, with these frequent meetings. And we were just saying that the projections don't indicate that we're going to be seeing each other less frequently as we peer into the upcoming holiday season. So I first want to just thank all of you for your patience and your time. This has been a remarkable commitment. We did not envision meeting, every 2 weeks, or sometimes weekly. But in this pandemic, you've all stepped up, given your time and effort. And I just want you to know on behalf of Dr. Eccles and Mayor Cruson, we really appreciate this Board of Health. So thank you for being so diligent with your time. It really has made a difference. So before we begin, we have in lieu of the minutes, we have the recordings, the YouTube recordings of our prior meeting, which will serve as our minutes. And so I need a motion to approve those recordings to reflect our minutes. Is there a motion?
Motion.
Is there a second?
Second.
Second. All in favor, please signify by saying aye or raise your hand. Aye.
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 Any
Aye.
opposed? Any abstentions? So moved. Thank you. Well, in the last 2 weeks, I think everyone here is obviously aware of what's going on. And so I just want to share a bit of data. And none of this is going to be particularly earth-shattering. We know that the rates are rising. But I want to tell you about 2 things that have alarmed me, and I shared these with Dr. Eccles earlier. So I'm going to have a share screen. Can I have a share screen, please? I'm always bad at doing this, but I'm going to try one more time. Last time I had trouble. Is that visible?
Yes.
Yes,
Great.
sir. But we're just seeing all 5 slides at once.
You are?
No, just one. We're seeing all 5.
Okay, so that's why I don't know why I'm having this trouble.
Zoom can do that to you.
Okay, give me 1 second. Let me try this again. My assistant doesn't come in until later. I'm going to try this one more time, and if not, I'm not going to waste a whole lot of time with this. Okay, it says screen 1 and screen 2. Why does it do that? Let's try screen 1.
That's the one with 5 slides.
Oh,
You
Maybe
just
do
need to
slide.
Dr. Ross,
yes.
so select the slide you want, and then on the lower right corner, use the presentation mode in PowerPoint,
Yeah.
and that will.
Yeah, there we go. We see it now.
Ah, okay. One of these days, one of these days. Okay. So this is the St. Louis Metropolitan Statistical Area Epi Curve. Again, we've seen this, and what the St. Louis Metropolitan Pandemic Task Force has been commenting on, Dr. Garza, is that we peaked, and it seems as if we're in a decline, but we really should not have any sense of comfort with this. When you actually backtrack the numbers, you can clearly see that we had a post Halloween surge And that was followed by an increase in hospitalizations. And then the latter slide, you'll see my concern about the increase in deaths. So we now have concluded Thanksgiving, and we are going to probably see a similar peak in cases within 10 days or 2 weeks after Thanksgiving. So our projections are that by mid-December, we're going to be back up. And guess what? In 2 weeks, there's another holiday. Wow, we know that, don't we? So again, we should not have any comfort in this. Here's what's bothering me. Now, this is data from our own, from Dr. Eccles and the staff here. Here's what's bothering me. Not just the peak in cases that we're seeing, the stabilization, but if you look at the number of deaths here, they're in this, the red bars down here at the bottom. It appears to be small. There are small numbers, but if you look at where we were back in the beginning of the pandemic rather, and then we had this lull in the summer, and the cases are slowly cropping up. But that's kind of what we would expect. They're kind of a past indicator of disease, and the leading indicator, number of cases, will certainly be followed by the hospitalizations and the deaths. And so this is worrisome to me, because this probably represents what would happen post Halloween, not even post Thanksgiving. And now we're going to see another post Thanksgiving curve and a post Christmas curve. And that's why Dr. Fauci made the comment 2 days ago that the next 2 weeks could be the gloomiest in terms of the pandemic numbers. And I think that we're clearly going to see that here locally. So here's the data that Dr. Garza presented yesterday. And these are hospital admissions in the St. Louis region, just hospital admissions. And just compared to where we were in June, where we were having 20 to 30 cases, 30 hospitalizations. I'm sorry about that confusion, 30 admissions rather. We peaked at 130 a couple of days ago. We're at 119. Again, do not be deluded that this is only a transient dip. We have every expectation that our hospital admissions will increase based on those factors I mentioned before. So there are two things that are bothering me. A, the number of deaths, and B, the fact, I didn't show this data, but the fact that our percent positive cases has increased from 17% to 19% over the past 2 days. That's highly significant, obviously, and that's followed by an increase in our 7-day moving average of cases. 130 in the city. Dr. Eccles, maybe a little higher. That I'm quoting the data from 2 days ago. So that's my concern. And now we certainly know what's happening. We're absolutely convinced of what's happening based on the data that we've seen, that that a mask mandate works, and counties that have a mask mandate have done particularly relatively better than counties that do not have a mask mandate. And you can see COVID cases in Missouri countywide, and the counties, the orange are the basically represent those counties without a mask mandate, and the blue represents those with a mask mandate. And you can see, the case level is 50% lower in counties that have a mask mandate. We know that for the most part, we're seeing what we had been seeing in Missouri. This is just Missouri data. And I want to really highlight that Chris Prainer has done a great job of assembling this data that compared to, here we're looking at cases in the red, and we're peaking back November 17th. But I wanted to show you what's happening in Missouri. Just remarkable, about 3 times higher rate in Missouri. And we know, we talked about this at the last meeting, we know this could be abated or mitigated by a statewide mask mandate. Everything shows that this would be, this is appropriate policy intervention to undertake. A statewide mask mandate we voted as a board to support the statewide mandate last 2 weeks. And nothing more needs to be said. We need to continue to pressure, put the pressure politically to make that happen. So, those are my those are my concerns. So I'm going to now stop and then let Dr. Echols present. And then we're going to have a discussion about how do we tack in this fast-moving wind in order to really protect our population. Fred?
Thanks, Dr. Ross. As Dr. Ross mentioned, one of the concerns when we were seeing the increase in cases, particularly in those individuals who are younger, those the 20 to 30-year-olds, the concern was that later on, because of the interactions with their family members, associates, friends, et cetera, that would eventually trickle back to or get to the older individuals in our community. And so looking at the most current data, we are seeing a slight increase in individuals over the age of 60. Part of that is due to some activity that's occurring in congregate living facilities. So we updated our heat maps, and one of the things that we saw was that some of the congregate living facilities were causing the increase in particular areas. So we reached out to them directly to see if they needed any resources, if they needed infection control training for their staff, et cetera. And one facility did say that they needed PPE. They were having difficulty getting PPE. So we connected them to our emergency preparedness program and got them resources. A couple of months ago, we were anticipating this happening. So we actually did a citywide survey for all of the congregate living facilities to see, again, if they needed any resources, if their staff needed infection control training, if they needed any other support from the health department. And we provided the resources that were requested at that time. But we do know that this is an ongoing issue, and we have to continue to be consistent in our engagement with the administrations at congregate living facilities, as well as some other congregate facilities, such as our correction facilities. So over this time, we've also been working really closely with Commissioner Dale Glass and his team to make sure that infection control protocols and operating protocols in the city's correction facilities have been compliant with city requirements. And so far, they've been doing an amazing job of handling any issues that arise in their facility. But we are concerned. We have seen an uptick in deaths, as was somewhat expected with the increase in virus circulating in our community. But we have to, again, remain vigilant in making sure that we do our very best to protect our most vulnerable population, which are one of those populations is the elderly, those individuals over the age of 60. So we'll continue our efforts there. We're also continuing to work with schools. So early on in the pandemic, over the summer, we worked with all the school systems in the city of St. Louis, and we were very thoughtful about what requirements or what mandates we should have for schools. We follow the science to establish our mandates, and the schools have been doing an amazing job. Every school in the city of St. Louis has an infection control and operating plan that they're following. There's been minimal transmission at schools. The issue has been, as I mentioned during previous meetings, the issue has been the exposures that are occurring in the community. And so families having small gatherings and meeting with friends, extended family, et cetera. And then those exposures lead to transmission, and then that impacts the schools. And so, but the schools, because of their infection control plans that they have in place and operating plans, they've been able to identify those individuals who need to be excluded, and they've been able to exclude them in a timely manner. We've gotten very little, very few issues with the schools, at least major issues with the schools. The biggest challenge has been getting parents to comply. So the health department, we work with our media partners as well as the school systems to get information out to parents so that they could better understand their role in helping us get through this pandemic. As we looked at what's happening, again, across the city, seeing increased transmission across, primarily among the young adults, we had to make sure they understand, children are going to follow what the adults are doing. So we need the adults to lead by example during this very difficult time. And so making sure that the information that we put out is simple and can be comprehended by the lay persons in our community has been extremely important. The documents, the infographics that were developed over the past couple of weeks have been well received by all of our partners and the community at large. And the purpose for those documents, as Dr. Ross mentioned a couple of weeks ago, was to really just make sure that everyone can understand what the requirements are in the city. But then also going a little bit further than that, we wanted to make sure that people could understand some of the consequences that can occur if individuals do not follow the requirements that have been set forth. And so Kimberly Vandenberg and Harold Bailey have done a great job of developing additional infographics that kind of show what happens when individuals don't comply with quarantine requirements, isolation requirements, and how that can facilitate the spread of COVID-19 in our jurisdiction. And so we're grateful for the work that they've done, but we're still not out of the woods. We're currently in this third surge that's put the city and the region in a much more difficult position than we were in before because of the impact that it's having on hospitals. When we look at what's happening in hospitals, we are very mindful of the capacity limitations, not only in beds, but also in staffing. And so when we look, one of the things that myself and Mayor Crusoe wanted to know is, where are the hospitalized patients coming from? And the city has a very small footprint in the hospitalizations, the COVID-19 hospitalizations in the task force hospitals. And what we're seeing is that there's because of the lack of mitigation measures in some of the outlying counties, they had increased case rates and increased hospitalizations. And because our hospitals serve as a safety net, not only for the city, but for the region and for outstate Missouri, those cases were impacting their ability to really perform medical services. And so that's still an ongoing issue. I'm grateful that Franklin County and Jefferson County have issued a mask mandate. I think one is for 4 weeks, and so we're grateful for the 4 weeks, and we're hoping that they'll be willing to extend that over the upcoming before it expires. But again, there's still much more work to be done, particularly for our schools as we look at what's going to happen over the holiday season. We're not out of the woods, so we need to make sure that the schools, before students return for in-person learning, all schools in the city of St. Louis, in the St. Louis region, need to have an infection control and operating plan so that these cases, these situations related to COVID-19 and other communicable diseases are properly handled and properly managed by the staff. We are aware that CDC is going to be updating their guidance. Right now, they haven't officially updated the guidance where they're going to be changing the quarantine protocol so that individuals who are exposed, if they have a negative test after quarantining for 7 days, they can return to their normal duties. Then for those individuals who do not get a test, if they are without symptoms for 10 days, then CDC will be allowing them to return to their normal duties. The guidance hasn't been published on their website yet. So as soon as that's published, we'll be looking at that. But more importantly, we're going to be looking at the scientific articles that they're using to support this new change in recommendations, because we also are still aware that the incubation period for COVID-19 is still 14 days. And so we want to make sure that, again, we're following the science as we make decisions in the city of St. Louis, because we really take our job of protecting the health of our citizens very seriously. And we'll be doing our best to also make sure we're in alignment with the other jurisdictions across in the St. Louis region, so St. Louis County, Jefferson County, St. Charles County, and Franklin counties. One of the concerns, even with that guidance, is we have the potential to miss those individuals who are asymptomatic. There's a study that was done out of Wuhan, China, that showed that asymptomatic super spreaders have in some cases driven the cases up. There was one case that was reported on where they found that roughly 3,900 secondary cases were associated with one asymptomatic super spreader who was not following mitigation measures. And so we're very mindful of that. And so we continue to encourage everyone who to comply with the recommendations that have been set forth, whether they're feeling well or whether they're feeling ill. Everyone needs to comply, because I tell people we're doing our infection control training that you just can't tell by looking at someone if they're infected or not. You can't tell even if they're even if they don't have symptoms, in particular for our younger individuals, because a lot of them who are testing positive because they've heard that someone else in their circle tested positive, but they themselves didn't have symptoms. So we have quite a few asymptomatic individuals in our community, and so we need to make sure that everyone is complying with the requirements that have been set forth to make sure we're doing our very best to slow the spread of COVID-19. Just to remind everyone of the current mitigation measures or restrictions that are in place in the city of St. Louis. The businesses, particularly bars, restaurants, and nightclubs, are still at 50% capacity. They still have a closing time of 11 p.m. The large venues are also, large and cultural venues are also limited to 50% capacity. Places of worship are still allowed to gather. However, they have to comply with the face covering requirements as well as the social distancing requirements. And the face covering is required for all attendees during those worship services. Right now, I know there's been some discussion about whether additional mitigation measures are necessary. And so for the city of St. Louis, so one of the things that we've wanted to do is make sure we were consistent in our strategy. We want to make sure we weren't issuing restrictions and then having to pull back and then issuing additional restrictions. And so we've been very consistent in our approach to handling COVID-19. A lot of the measures that are restrictions that are currently in place have been in place for quite some time. The latest restriction that was added was back in September, actually November 14th, which was prohibiting gatherings of 10 or more individuals in private settings. And so that will be in place for some time. The concern, I know as we look at the numbers, but the concern is, we have additional restrictions, particularly on businesses, what that could have, but also if we're not following the data, then we could be causing unnecessary harm to some populations. And so when we look at the data, we continue to see that the transmission is occurring in these small private gatherings. And so to put additional restrictions on businesses could potentially, as Serena Muhammad mentioned during our last meeting, could drive everything underground. And so when things go underground, that makes it much more difficult for the health department. And it can also lead to a higher number of cases, because when things are underground, they are less likely to comply with city requirements, with facial coverings, requiring social distancing, and so forth. And so that could lead us to much worse trajectory than we're on right now. And so we're really mindful of that, and we're trying to make sure that we follow the data and implement a targeted approach, because we are, again, unaware of some of the unintended consequences that can arise when we implement these mitigation strategies. We know that there's a lot of discussion in Congress as well. We'll be looking at the fiscal, we're aware of the economic impact of COVID-19. And so we are following what's happening at the national level as it relates to the second stimulus package. We're hopeful that a stimulus package may be available before the end of the year, but that's not promised. And so we're starting to prioritize our issues in the city of St. Louis, so that when the funding does become available, we'll hopefully be able to get it out in a timely manner to, again, to really soften the pressure, soften the blow that COVID-19 has had on our population, as like from an economic standpoint. So those are my COVID updates. I do have some other general updates, because as everyone knows, COVID is one thing that public health agencies are dealing with. So there's all these other public health issues that are still looming in the background that have to make sure that we're not ignoring. So I'll provide more information about those in a few moments after we take questions.
Okay, thanks, Dr. Echols. So we understand the situation, and this is now we have to have a very deliberate discussion about this. Cases are rising, fatalities are slowly increasing, and we have, Dr. Echols laid out, a relatively robust process. Nonetheless, here's the reality: 1 in 5 cases that are administered in the city are coming back positive, and that number is increasing. That is concern. And so the issue is that what are we doing that could continue to protect the public in that setting? Now, I'm going to let you know, I think that our businesses and restaurants are doing, for the most part, they really are doing what they can. And I wanted us, and we made that statement last 2 weeks ago. I also don't think it's proper to target one particular industry. Restaurants have been obviously highlighted, and to impose restrictions on them disproportionate to other businesses. I don't think that's fair, and I don't think the science, as Dr. Eccles, supports that. So I am, both personally and professionally, not supportive of further restrictions on restaurants. Nonetheless, I am concerned, Dr. Eccles, that although the R naught, the infectivity level is around 1 that's good, that we're doing a good job of mitigating, so we're not seeing the immediate propagation, but I am concerned about where we are now and what's going to happen in 2 weeks and what's going to happen in 4 weeks. And so here's the question: do we hold steady as we are now, or do we think about what we can do additionally? And I reviewed a lot of what's going on in localities like ours nationally, and the only consideration we could have right now is to further restrict all activity, businesses, retail, others, to 25%. We're currently at 50%. Now, that may not have much of an impact. It may be counterproductive economically, but will it have a benefit in terms of mitigating the spread? That's the discussion I want to have this morning. That's the discussion on the table. And so I just want to hear, let's kind of mull it over, and then we'll make some decisions. Thoughts, concerns?
We'll talk a little bit about the approach for businesses. So our requirement is, again, for all businesses to comply. So we've gotten complaints from gas stations, restaurants, apartment complexes, and so we issue every business that is not compliant either a cease and desist notice initially, and then after that we'll issue a closure notice. In some cases, the violation is so egregious that we just issue a closure notice. And so we've also been extending our closure timeframes for businesses that aren't compliant because of the current situation that we're in. So in the past, it's been really 14 days, but more recently, we've been issuing closure notice for at least 30 days for businesses that are not complying. So I want everyone to know that as we have this discussion.
Thanks, Dr. Eccles. I think that's highly relevant. The point is that something could happen, adversely, and we could be here in 2 weeks with just escalating cases, and then we could be talking about, oh my goodness, we're on the verge of another shelter in place. And that's why I want to have this broader discussion. So any other thoughts and comments about this? Tim?
Just one more before we get into that discussion. I just have one quick question or put something on the table. Have you both reflect on it? You listed things you're concerned about, and I would just want to add to that concern. Dr. Ross, you're in the hospital. We're seeing hospitalization rates that are really high. The numbers I'm hearing are 90% capacity. Is that right? And I'm seeing that our hospitalization rate is like twice what it was in the spring, and our ICU rates are approaching where we were in the spring. Is that correct? And so the other question I would ask is, how much of those numbers are from outside St. Louis? Dr. Eccles, you sort of mentioned that there were many of them. Do you have a number, or do you not feel confident putting a percent on that?
Yes. So the last data that I received showed that 89 of the individuals that were hospitalized were city residents. All the other individuals either from St. Louis County or other jurisdictions.
89 out of. Oh, did he freeze?
Yeah, he just froze there. And so, that's been my understanding, Tim, is that the overwhelming majority of these cases are coming from outside of the St. Louis City and County, and they're taking up a considerable amount of the ICU beds and
Okay.
really posing major burdens. We are over 100 patients in Barnes Jewish Hospital who are COVID positive. A quarter of them are actually in ICU. I may be wrong. A quarter of them may be intubated. I'm sorry, in ICU. And again, our concern is that we reached a point where we don't have adequate. We're exceeding the point where we can provide adequate nursing, and so we're having to contract out nursing. We had this discussion earlier, and obviously we're curtailing elective procedures and some of the things we did back in March. So this is happening. The burden on our hospital systems has started, and it's extensive, and so that's
reality. We're already cutting back on electives, and so on the question you're asking about what to do about the restrictions. My understanding is the county's restricted no indoor dining for restaurants. So we're at 50%. So we have a different order than the county. Is that correct?
Right. So the county has no indoor dining, and based on the data that I got from our own health department, the restaurants in our city have been really on top of this. They for the most part, they are adhering to the capacity, and for the most part, they're adhering to the mandates on masks. So that's why I said at the inception, I don't think it's proper to target one particular area when we can do the tracing and we know where the cases are coming from, and they're not coming disproportionately out of restaurants. And so, from an epidemiological standpoint, I find no reason to have an undue burden on restaurants. Nonetheless, 1 out of 5 cases are coming back positive, and the numbers are going to increase. What we're doing is working to only a partial degree. We're losing. We will lose the ability to maintain the numbers we have with that level of propagation. And so that's the discussion. What do we hold or do we move incrementally? And if we do move incrementally, the next step would be to further reduce large gathering capacity to 25% from 50%.
If I may.
Yes, Maddie.
If I may, so a couple of thoughts. I've been truly impressed by the health department and this group's commitment to following the science. And in so doing, I agree with some of the sentiments that have been reflected today, that there's a lot that we don't know, but there are trends that I do think we can also reflect on from earlier in the pandemic and from this summer. First among those is, the data, we know that our higher risk groups have been throughout older and people with comorbidities, but we also know that towards the end of the summer, we saw an increase in the younger demographic, our 18 to 25. And I believe that there should be some focused and targeted education and thoughts about why that may be. Second above that is that those of us in the healthcare system we are in trouble and we are struggling. And we are seeing this, and I advocate more, not just for physicians, but our nurses, our essential workers who are cleaning and doing some of the essential things up on the front line who don't often get a voice. And to that, I say, we also know that the science, and the CDC has a great website up right now about winter indoor, in indoor spaces and ventilation practices. So while I agree that businesses in general, and I do not want to target one sector, are probably adhering as much as they can, I don't know that we can adequately account for them being able to do so safely, even as best as they can, in a winter season that we know comes with it people having to be indoors more, and we know what the data about transmission is around that and ventilation. So I would personally be in favor of us discussing a global globally coming down on and furthering the restrictions, either incrementally or talking a little bit more about that. Because I do think some of the messaging also has to shift to flu season and all the other respiratory viruses that are coming, and how much we are going to see that, continue to overwhelm our hospital systems.
Thank you. So, Dr. Maddie, what I put on the floor right now is reducing from 50 to 25% capacity across the board, not targeting any one particular business. We at this point, we're are in a position based on the data to really go any further than that, because we have to wait and see what happens in the week or so. But in a recent data that actually was chaired by my Department of Medicine chair, Dr. Vicki Frazier, as well as other infectious disease people, and Dr. Maddie is an infectious disease expert herself. We wait a week and we extend this out, and so the longer you wait, if we're going to do anything, then the shorter the impact, because we will then have more people exposed. And so that is concern. I think you just expressed it. Other thoughts?
I want to pick up on the comment about what might need to shift because of the weather. For those businesses who are at 50%, if there are things that need to be done differently related to ventilation or other issues, I know that the health department is already providing significant technical assistance to businesses that are trying to adhere to the guidelines. I wonder if there are other things that we should be considering adding to that list of options for those businesses. And I don't know if that's something that we could supplement as far as funding goes. I have no idea how much it costs to address the ventilation issues, but I think if there are things that need to be done differently in the winter, we need to figure out how to communicate that if it's not already being done.
Dr. Echols, want to respond?
Yeah, so we've started having discussions about ventilation and improving HVAC systems and UV applications for businesses, and so some of them have already adopted or improved their HVAC capacities. And so, but that's just one component, because that's, as we talk, there's no panacea for COVID-19. All these mitigation measures have to be done together, and so although that's a good option, I think that will place a lot of businesses in better position moving forward. They also have to make sure that they're compliant with those other requirements that we've set forth. And so we've been communicating with them. We've also made sure that there's testing available for some food corporations that have requested it. So we're trying to go above and beyond to make sure they have the resources that they need, and if they so they'll be able to identify any staff that may need to be excluded from work. So we're trying to make sure all these things are made available to them with minimal barriers again.
Thanks, Dr. Echols. Other thoughts, comments?
I have a question. It seemed like in one of our meetings we talked about the fact that we know that most of the current infection is from gatherings in private homes. I don't know if it's the big events as much as like Thanksgiving, Halloween parties, Christmas coming up. So is that true? I mean, is doing these further restrictions on businesses just going to get us a quarter of an inch, whereas if we had some impossible way to affect the behavior of humans in their private gatherings, we would, go further to address what, might be coming up? Do we know the sources? I know contract tracing has been really difficult, but do we know, in fact, that, 7 of our new cases are from people in their homes?
So we know that the significant majority of those cases are coming from private gatherings. Dr. Echols has certainly been very assertive in reducing the weddings and all these other birthday parties that are out. That's been helpful. And so that is true, Lisa. Nonetheless, those people in those private gatherings are gathering their things and they're going out into the public. they're propagating what they contracted in a private setting in a public setting. So that's the dilemma we're in.
Okay. So reducing the number of people in businesses will automatically reduce the opportunity.
We're just having the discussion. I don't want to make any major statements. We're just having the discussion. I gave you my perspective, but we have to hear from others. Rhonda, Baloo, I think you had your hand up.
Yes, I was just curious about a little bit more of the details of the science. I know we have a 50% restriction on restaurants and things, but I've driven up and down South Grand and seen restaurants that look like they're almost filled to capacity, even though they're 50% people are in pretty close proximity. But given that I think we talked about this on the last call, that in terms of even the financial viability of the businesses, that they might be at 50% now, but now it's getting colder and more people are going to want to come inside because a lot of the restaurant business has been outside. And is 50% across the board? I think in terms of HVAC and circulation, it depends on kind of the shape of the restaurant and the physical structure. Are those things taken into consideration? I mean, I passed Rooster, it's a pretty open design and it was pretty full, but a 50% capacity restaurant that has a design that's more closed in. I mean, I think that based on kind of the physics of and the architecture, 50% is not necessarily 50%. And I mean, I don't know that there's probably not the money or funding or person power to really address all of those things, but are there at least any guidelines or any thoughts about, what capacity really looks like given how businesses are actually structured? I mean, if your business fits 20 people and there's 10 inside, it's different than if it fits 100 and there's 50 people inside. So, is it, and I might be getting nitpicky, but now since it's winter, more people are going to want to do inside activities. They're not going to want to eat outside in the restaurant. Is the 50% rule, does it really make sense for every type of business and different types of architecture?
Well, I understand what you're saying. Before I respond, what would you recommend?
I mean, I don't know if there are any kind of basic guidelines, or even you can think about guidelines, if there's anything out in terms of the current literature or research, based on, what does your circulation system look like? What is your ceiling height? Like, hey, how should you do your seating arrangement given what your architecture or your building looks like? I don't have a solution, but I can't imagine that 50% capacity in some place it's kind of an open square is the same thing as 50% capacity in some place that's a little bit more closed. I usually don't like to bring up issues with no solution, but I was just thinking it's not, the same 50%.
Sure.
And I would
I
think
have to
with
say-
a 30-foot ceiling would matter in a 50.
Yes.
Sorry to
Yeah.
interrupt, Serena.
Yeah,
but go ahead.
30-foot ceiling versus someplace with a 10-foot ceiling. And
Yeah, but I was going to say, I have the same reaction to the guidance around 10 people in your home, because, a person's home is going to be very different in how much capacity they have. I think all of it is just a guidance so that people can make the best decision based on whatever architecture or building that they have. The thing that's difficult is getting people to adhere to the guidance. And I think it's kind of the low-hanging fruit to create regulations, but it's the behavior change that we really need to figure out and focus in on. So when Dr. Mahdi made the comment about younger people and do we have messaging for them, or are we able to figure out what some of those drivers are? How do we communicate to different subpopulations? I think we need to spend more energy on figuring out the behavior change than coming up with additional regulations. Because even if we tell someone, that you should be at 50% capacity, but their patrons come in and they don't want to wear their mask when they're not eating, or whatever else it is that people are doing, then that 50% doesn't make a difference because the folks in the building are not adhering to the basics. So I understand the desire to just be able to set a rule and expect people to follow it, but we've seen so far that they're not following the rules that we already have. So what
Yeah.
can we do to reinforce some of that, change in behavior?
I wouldn't even suggest in terms of like architecture to set any, because you're completely right. I mean, the rules are not working, but even some guidance to like, hey, consider your ceiling. Just to put that information out for businesses. Consider your ceiling height. These are the factors. These are the physical factors that encourage spread. Consider, just so people can keep that in mind when they're configuring their tables and chairs and things for the winter. So I wouldn't suggest that, oh, well, if you don't have a 30-foot ceiling, you have to do 30%, but to let businesses know that, consider your HVAC system, consider your ceiling height, consider how open your space is when you're configuring, and maybe just giving some information and not necessarily guidelines so people can think about those things.
Okay, Tim, and then Susan.
Just real quick, just adding on to Serena's point, and this will be a question I'll throw back to the doctors because I'm just an economist, I'm not a fake doctor. So, and I would think my understanding of the literature is that things that really matter are number one, masks, but of course you can't wear a mask while you're eating in a restaurant. And what I understand number two is social distancing, so 6 feet apart. And then, and then some of the other things that people can do. And then, it's all about messaging and everything else. But it strikes me that those things matter the most. So maybe it's not so much the percentage, but the masks and that you don't go when you're sick and that you're socially distanced and so on. And I might just throw that to the, what do we prioritize, the percentage filled of the room or that they're socially distanced while they're in the restaurant?
Okay, yeah. I have an answer, but we're gonna go on. Susan?
We've talked a lot about mitigation strategies in terms of the distancing and cutting capacity and so forth. But the other thing I heard Dr. Eccles talk about was the importance of testing if you have been in a gathering, if you think that you have been exposed, whatever. But anecdotally, at least, I am hearing that people are still having difficulty getting tested, even in areas where we think there are a lot of tests, and there are still delays, 7 to 8 day delays sometimes in getting test results back. So the other thing I worry about is we're telling people to do all this, but even the things that shouldn't be difficult to do seem to still have some difficulty region-wide, not only in the city, I'm talking about the county as well. So has that been others' experience? Is that an accurate statement? And if so, how do we help to at least make these recommendations more doable?
Okay, so here's in summary what I'm hearing, and I'm going to have Dr. Eccles respond. Clearly, there's a desire to do something, but there's a desire to do something with a sense of equity, particularly around Professor Ballou's point that not all spaces are the same, and if we impose more restrictions, we want to make sure that indeed we're looking at apples to apples. That some buildings will have ability to accommodate a few more because of aeration and other issues. And so there are other issues about equity. Susan just mentioned in terms of access to testing and PPE. I mean that's a larger issue that we're not gonna be able to address in this discussion. We'll get back to that. So an issue right now is, can we construct ways to allow business to interpret the current guidelines well? I spent several hours late last night looking at guidelines across the country, particularly rather than saying 25 to 50%, you could say if a building can accommodate 1,000 people comfortably, then you reduce it to an X number of people, rather than actually pose a percentage. I mean, there are ways of doing what you just mentioned, Rhonda, and there are guidelines that we can construct to do just that. Hearing all of this, none of this has altered my belief fundamentally that we are putting ourselves in a position of coming back, and maybe even sooner than 2 weeks because of the anticipated spread. None of our discussion has convinced me that we're not using the most effective measures to contain spread in the larger areas. I still harbor that concern. And after hearing this, I'm still in favor of reducing business capacity to 25%. I've heard nothing that would dissuade me from that. So let me just turn it over to Dr. Fred, your response.
So I'll talk a little bit about the testing capacity and those issues before I talk about that. So testing has been an issue, not only in with the federally qualified health centers, but also in some of the private offices and the urgent care centers because of the demand. So over the past month or so, month and a half, the demand for testing has just increased, and as the testing volume increases, that typically leads to a backlog because the private labs are overwhelmed. And the major laboratory that serves this area is Quest. And so when they're getting bombarded with all of these tests that they don't have the capacity to handle them, that leads to the backlog. And so we're experiencing that. It's not as bad as it was before. So we're not having the 14-day delays, but some individuals are getting their results, say 3 to 5 days. And that's still a long time because people need that information to determine what their next steps will be. And so we've identified some additional support. And so I've talked with some individuals about next steps, and so we're hoping that that system will be in place before the end of the year. But again, it's not something immediate that will be done. As it relates to the capacity, to Dr. Ballou's point about the ventilation. So I did an interview with Sauce Magazine recently about this very issue. And so one of the things that a lot of the restaurants aren't aware of is the guidelines that currently exist around HVAC systems and and the standard guidelines that have been established by ASHRAE. And so we made sure that the ASHRAE's policy statement, as well as the documents, the guidance document, was shared with the individual that I was speaking with. And so there's still a lack of awareness about available resources, and that has really been a sticking point for businesses not knowing how to implement certain things to comply with certain mitigation measures. And so, and that's as the health department, that's our responsibility. And so we've been working with them as best we can, but we also have to be mindful of the capacity of the system. And so as I talk about, the response for COVID-19, we also have to be mindful of the pre-existing condition of the state of public health in the city of St. Louis. And so as I told the group during my talk with WashU is, we had less than 90 staff at the time before COVID-19. And so, and being able to lift the work that we've been able to do has been important. As we think about mitigation measures, we think about the number of cases and those things. There's a significant strain on the public health system as well as the hospital system at this point. And based on the data, the information we get from cases and their contacts, I'm not sure we will actually see a return on investment for implementing additional restrictions on restaurants.
Yeah, again, we're not looking singly at restaurants, and I've said before that I think that the restaurants have been more than involved, more than engaged, and I want to make sure that we're not just talking about one particular industry. We're not. I understand that the law of diminishing returns when you have a limited number of staffing. I also want us to consider the overall implications of going into the winter with more movement indoors, not just in private homes. That is a concern. And so I want to think about all these other big box corporations and and stores, particularly retail. That's been my concern. So.
And also, just one thing, we also have to think about, as that came up during the last discussion was, what happens if the additional restrictions just drive things underground? Then we have a different situation, because at the core of everything is still behavior change. And so I think we'll, in some ways, I don't say be spinning our wheels, but we'll be chasing the cat, but we're chasing the wrong cat. And so I think we know the behavior change is really the key, and that's been the most difficult thing to address in public health for decades and centuries. And so I think having the regional approach, I think I've communicated with Serena about RRT and developing messaging and those things, but really having a unified approach to addressing behavior is really key.
I understand that, however, policy can affect behavior. All of us in public health know that, all right? And we know what happened when we had a policy against tobacco smoking. It changed behavior. So there, it's not so simple there. I saw Rhonda's hand and then Serena.
Talking about behavior change, we've had several of our board members mention, Dr. Maddie said, where is the messaging for the youth? Have there been, I know we used to have kind of sometimes a youth kind of advisory board, that a young person that used to come to the meeting on occasion, but I mean, is it possible to kind of do anything innovative, like some kind of contest for, youth, young adults 18 to 25 or something, to do some kind of messaging about mask wearing and COVID prevention, and maybe like kind of do some kind of innovation or prize or something like that, just to kind of get community involvement in the messaging, as opposed to just sending out the messaging. Is there any way to get any kind of community involvement in the messaging? And I think that might help with behavior change if we said, okay, hey, we're having a messaging contest, and with creative messages about how to stay safe during Christmas or during the holidays, and invited young adults or artists or youth or some folks to come and actually do some kind of contest where, maybe we run their message, for each week during the holiday or something like that, or there's some, so there's some kind of community engagement in the messaging. I mean, I'm just throwing out some ideas, but is there any way to, as opposed to just sending out messaging and expecting people to listen, to have the messaging come from the community and have the community engaged, and so that maybe they would be a little bit more inclined to change the behavior if they're actually involved in the messaging and they do the messaging?
I frankly think that the messaging has been heightened. I think that the team that's been assembled, both at the health department and the community, and the people that Dr. Eccles has contracted, particularly around his infographics and getting this message out, I think they've been community involved, and I'm impressed, frankly, with the messaging. I'm absolutely impressed, given what the changes we made just in a month. So I think it's just a matter of getting that disseminated even more. I don't know if that's the limiting factor right now. I think the messaging has been really elevated, and I'm pretty impressed with that. Time is of the essence, so I'm going to take a couple more minutes. Here's what I'm seeing. I'm not seeing a great enthusiasm around reducing the capacity. I'm just kind of reading body language here. I would support that, but I'm not hearing a great level of enthusiasm about that. So if someone wants to, so we may have to hold on that, and then follow up on what Dr. Ballou said earlier about looking at particularly how certain businesses are structured, to see how they can then comply. But I want to make sure that I'm not misreading everything. Dr. Maddie.
I'm going to say something a little difficult, but I just want to be clear. I want to first say that I too think that the city has done an incredible job with supporting, with businesses, and with messaging. I believe that this is a difficult situation because of the balance between the science, behavior, but what needs to be done for effective public health strategies. We saw, and if we remove what's been happening in the US and we even look at countries that have been more successful in being able to drive down the numbers and keep them down, that there have to be periods of time when the numbers are so extreme that we have to adopt difficult measures that we understand may hurt businesses for some time, and measures that we understand may not make us very popular. I say this as someone who is actively involved in the front lines right now as well. To that effect, my concern, I definitely, if the only thing that is on the table is reducing capacity, I am highly in favor of that. However, I want to further the discussion to say that I do believe that soon, or even now, because of the urgency of what the numbers look like, a discussion around even more higher extremes needs to be had, because as much as we're all trying and as much as equity is important, something is not working. I definitely hear the conversation around contact tracing, but again, balancing that with effective public health messaging and people understanding what needs to be done. Not all businesses have the same behaviors attached to them, especially the removal of masks. So I do say that I think that conversation needs to be on the table, and having to have delays by a week or two can be really difficult with where we are in this winter. And that's what I want to be clear. This is not an attack on any one business. This is definitely not to discredit the incredible work that's been done. It is in response to where we are, right? Where we are right now. And I think the urgency of that needs to be reflected. So I am definitely in favor in reducing if that's the only thing on the table, but I'm very clear in saying that I think discussions need to be had about changes beyond that, or further restrictions beyond that.
With that impassioned plea from Dr. Maddie, we'll have an order about the next step after we hear from Dr. McBride.
I just want to speak up in support of what Dr. Maddie said. She articulated a lot of what I was thinking, and there, as you mentioned, around the world, these statements, these policy changes in themselves are an expression of the urgency of the moment. It's clear that staying at home worked in the spring. It worked for a while, and then it stopped working. What's frustrating to me, I'm not a public health expert. I'm an economist, but what's clear to me is we're sort of being pressured by forces outside the region. So again, kudos to Dr. Eccles and to the county for everything they've been doing. But every additional case that comes out of the city is adding the pressure on the St. Louis region hospitals and system. So, so I was sitting here thinking, Dr. Ross, when you're sort of taking it off the table a little bit, is that the wrong message to be sending about the urgency of now? Because I do feel like in a week or two, we're going to come back here and say, we need to put this down to 25%. So we as a board may need to say, just as a message, that's important, because it's urgent. I mean, I think it's an urgent situation right now, and I'm worried about the nurses that were talked about earlier by Susan and others, and the doctors that are stressed. And Dr. Maddie made a great statement.
So with that statement, one final quick statement, Lisa, and then we're going to move on because Dr. Eccles has some other information. Lisa.
I just want to ask, the restaurants are all closed in the county, right? And we know there's been a big, ban on that, but we're all one. So I would agree with Dr. Maddie and Dr. Ross, about the 25%. or maybe going all the way. I don't know. I mean, we have to, like you said about smoking, Dr. Ross, you know, we saw that policy changed behavior. We might have to be a little more top down. So I'm leaning in support of, you know, what you've brought. That's all.
Okay, is there a motion then on the floor?
So moved.
And the motion is regarding reducing all business capacity, all business capacity to 25%. Is there a second? It's been moved and seconded. A point of order. We do not have a quorum based on my count. And so what we can do is take this vote, and then we would take this vote as an informal recommendation. It would not be a formal recommendation because we do not have a quorum, but we can make an informal recommendation to Dr. Eccles, to carry to the mayor. Okay, so it has been moved and seconded. Any discussion? Discussion, Dr. Blue.
It's just more of a question. How are these guidelines typically enforced? I'm just curious, and what, you know, in terms of compliance and what health department, and I know the health department is extremely busy and has working beyond capacity to manage all of this. And I know that would be hard to enforce, but I'm just wondering, is there any idea of what the compliance has been in terms of having 50%? And I mean, I know some businesses are doing excellent work. And then, like you said, that it's hard for a waiter, waitress, or a bartender when more than a certain number of people want to come in and don't wear a mask, when you're, you know, just the hostess to say, hey, we're at capacity. So is there, just what are the methods? And I'm just asking what is the enforcement?
Well,
and
I think that what we've seen as we reduce from 100% to 75%, we saw action. There are people who want to do the right thing. As we reduce from 75% to 50%, we saw more action. People, our businesses want to do the right thing. They are just as concerned. That should not be our major concern at this point. I was
just curious. I wasn't.
So yeah, there has been response. And in fact, I would say Dr. Eccles made this point a month ago that there are some businesses that are already at 25%, maybe functionally or practically at 25%. So there are some people who want to do the right thing, Rhonda, and that's what we're trying to talk about. We're going to get back to this level of enforcement if we have further propagation of COVID. So
I was just asking a question because I didn't know what the effects were.
It has been moved and seconded. All in favor, raise your hands so I can count here. 1, 2, 3, 4, 5. Okay, 1, 2, 3, 4. Okay, 6. Wait, we have 7 people. We have 1, 2.
I've got a hand raised.
Okay. Oh, okay. So, Chris, was your hand raised or not?
It was.
Okay, so we had actually. Okay, so what we have is the majority of the board.
And did you get the no's registered?
I'm sorry, I should say that. Okay, thank you, Tim.
No's or abstain.
Any opposed, say nay or raise your hand. Any abstentions, raise your hand or say nay. Okay, so Dr. Eccles, without a quorum, the majority of the board members who are present support the motion. That's an informal recommendation to restrict capacity to 25%. And so we'll take that to discussion with the mayor. So this is not easy, Rhonda, you just said, this is not easy. But at least also said that, but I think that this was, a message that has to go out. I'll turn this over to Dr. Eccles now.
So thanks, Dr. Ross. So as I mentioned before, so there are several other activities that the health department is spearheading during these unprecedented times. And so I'm just going to give a brief overview because there are several things that are kind of in the pipeline. Also in support of our COVID-19 activities, the health department will be receiving $200,000 from the Centers for Disease Control Foundation. This is for a specific project that we submitted a scope of work for related to communities of faith. And so this will allow us to provide at least 10,000 COVID-19 care packages for communities of faith throughout the city of St. Louis. This will be a program where we'll be using partners across the system to distribute the package and distribute the resources, but we'll also be working with our partners to evaluate the impact of the provision of these resources on individuals. In particular, we want to see if this if providing these resources increases compliance with face covering required mandates and so forth. And so we're really excited about this. This project will go from actually December 1 through June 30th, 2021. The length of the time is just so we have enough time to collect the data, analyze the data, and package a report that can be used for future policy development. We're also working with Cure Violence. So we all know that violence has been at the forefront during the COVID-19 pandemic and has been exacerbated in some ways. And so we continue to work with Cure Violence Global to stand up the 3 Cure Violence sites. So one in Walnut Park, Dutchtown, and Wells Goodfellow, Hamilton Heights. And so the team from Cure Violence Global is actually in the city this week doing training for a lot of the staff and helping the last 2 sites, so Walnut Park and Dutchtown, complete their staffing to hire individuals to actually do the work. We're really excited about that. We're working really closely with the Violence Steering Committee, as well as the mayor's office, to make sure that this the program is implemented with fidelity. And so I'll hope to have additional updates during our next meeting regarding all of the sites being up to speed, as well as some updates from the Secure Violence Steering Committee. We're also working with the health department received funding during this fiscal year for first responder co-responder activities with for the police department. And so in the past, this was called the Cops and Clinicians Program, but we've changed the name. And so we'll be working with Behavioral Health Response, again, the mayor's office, as well as other partners to make sure that this program is implemented. This will help reduce the number of individuals that are incarcerated due to mental health or other issues. So instead, this is really a diversion program. So making sure that individuals who call 911 with behavioral health issues are connected to behavioral health specialists rather than being incarcerated, if you will. And so this program, we hope to get this program up and going soon. The contracts have been signed and we're working to get those executed. We're also receiving a similar funding for a similar project through SAMHSA. This is $1.6 million over 5 years. This project was applied for a few years ago through the Department of Human Services, and then SAMHSA revisited the application and felt like it warranted funding. And so the health department, we're working to transition the lead agency from the Department of Human Services to the health department. So we'll be overseeing that work as well, and we're hoping to get that up and going soon as well. And last but not least, food safety. As we've talked about restaurants and other businesses, food safety is really important as well. And so we have worked, our team internally has worked to update the food safety code. So we have a draft that has been ready. And so we'll be working with the mayor's office to get that introduced to the Board of Aldermen, and also share the draft with the Board of Health and Hospitals.
Well, that's impressive. Congratulations.
Not done yet. So we have one other thing. So World AIDS Day was on December 1st. And so hope everyone was able to tune into the session that was held. Dr. Maida, thank you for your contribution. It's been phenomenal to work with you. And we have one major project that's coming out of this. So for several years, Christian Hospital serves as a safety net for North County. but they had not officially adopted the opt-out screening for HIV testing. And so at the start of my team with the health department, I started having discussions with their president, Rick Stevens, and their core staff. And so they're in the process of actually getting enrolled as an expanded testing initiative site with the state and WashU, where they'll be offering opt-out testing for all of their individuals that come into their ED. And this is really remarkable, not because of their they serve as a safety net in North County, but I recently learned that they have the busiest emergency department in the state of Missouri. And so this will help us really identify individuals who are living with HIV in a more timely manner, but beyond getting them, beyond them knowing their status, every individual that tests positive through this program will also be connected immediately to a case manager that will help them get connected to care. And so the time from a diagnosis to their first physician's appointment or laboratory appointment will hopefully be less than 30 days, which is better than the national standard, if you will. And so we're really excited about this, and we'll keep you updated as things move forward.
Well, that's even more impressive. So, well, kudos, Dr. Echols, and to the health department staff, particularly on the grants received, the federal support, which speaks volumes about our ability to really execute those programs effectively. So that's just incredible work. Okay, so we have no further information to share. At our next meeting, I'm going to ask Dr. Echols to give us an update on the opioid epidemic in the setting of the COVID pandemic. I've been, again, looking, and I'm getting more concerned about that. I've always been concerned. I'm getting even more concerned based on some of the data that was shared with me earlier this week. And so we'll have an update on that. And so
I can give a brief update. So there's also an exciting project that's happening there. We're working with Ed Plus, as well as the UMSL and the Fire and EMS department. So we're working to get Leave Behind naloxone program for the Fire and EMS department in the city of St. Louis. And then we're also working with, start working with the Behavioral Health Network to implement the EPIC program in the city of St. Louis. It's been in this county for quite some time. And so we're looking to have that implemented in the city as well. And so those things are underway in the city to help address the opioid epidemic. But again, there's still a huge, a lot of work to be done to address what we're seeing.
Well, you just addressed part of my concern. I was going to ask about the EPIC program. So you read my mind, Dr. Echols. Thank you. That is very good news. Tim?
Can I make a pitch for maybe a couple agenda items? And again, kudos for all your hard work, Dr. Echols and your team that's listening. So maybe a couple agenda items for the next meeting or future meetings. We've heard some really good news on the vaccine, if I understand it correctly, that may be coming. I'd like to hear some reports about our plans for that. I know it's going to be months down the road before the general public gets it, and I understand it might be health workers first and then nursing homes and so on, but it might be useful to hear what the plans are for that. We've raised several concerns here about messaging and making sure that it gets out to everybody in the community. So if we could have an update on that, I'd appreciate it. Also related to the opioid epidemic, I made a comment about this in a faculty meeting recently. I'm concerned about the mental health aspects of this COVID epidemic in general. I'm wondering about both the mental health and human service, hidden aspects of what's going on with the epidemic. And I don't know if that's appropriate for our committee to discuss this, but I wonder if that, and maybe that doesn't fall under the purview of your department, but I worry about things like, are we seeing rising mental health concerns maybe coming through opioids? Is it coming through child abuse? Is it coming through, a lot of people are staying at home right now, doing classes at home. There's a lot of stress out there in the community because of what's going on. And I don't know if that's an appropriate topic for us, or you can reject it if you want.
Yeah, that's extensive discussion, and so we really would have to make sure we've taken some time.
We'd want to get an outside expert in to talk to us.
Precisely. We want to make sure that we really are doing justice to that that topic, and I don't want to give that only a 5 or 10 minute discussion.
No.
So important. And so I think that we'll have a little bit more about I agree, we can talk a little more about the vaccine preparation. Dr. Echols already has given us some good news about what we're doing with the opioid epidemic and EPIC. And so in the meeting afterwards, Tim, I think we can address that issue. Because again, it's such an important issue. I want to make sure we give it the appropriate time that it requires.
Thank you.
Okay, so we have, in conclusion, we have this recommendation. All the members of the board voted affirmatively. We were not at quorum, therefore it's an informal recommendation, but they all voted affirmatively to support the restriction, and then we'll have a discussion at the next meeting about anything more. But the date for the next meeting, Kim, we're gonna, well, I think we already have something on board for 2 weeks. So the next meeting will be December 17th. I have that on my calendar. Thank you, Kim. Okay, this has been tough. This has not been easy, but hard decisions have to be made in this setting. Thank you for persevering and getting us through this, and I'll see you all in a couple of weeks. Thanks again. Bye-bye.